Many CS moms I know want to try vaginal birth after cesarean section, also called trial of labor after cesarean section, TOLAC and VBAC. Now, it is normal for you to want to try vaginal birth. A lot of women want to experience that natural birth. I don't know, they take it so personal that they just want to feel it. All right. Now, in as much as it is a good idea, there are so many things for you to consider. Now, before I start telling you things to consider before you try vaginal birth, I want to remind you that, number one, if you had vertical incision during your surgery, don't try it unless you had lower transverse incision. That's why you can now say, I want to try vaginal birth after C-section. 2, if you have had a major surgery, not cesarean section, like another major surgery like myomectomy or any other laparotomy, any other invasive surgery before, please, I will advise you not to go for it. If the last cesarean section you had is not up to 18 months, go for another cesarean section. And if your babies are extremely big, please don't go for another one. And if you are above 37 years of age and you give birth to cesarean section, please, I will advise you to go for another cesarean section. Don't try vaginal delivery. But in everything, make sure you speak to your midwife and your doctor and decide together. Okay? Now, if you want to go for vaginal delivery after cesarean section, the first thing to consider is the position of the baby. Now, position of the baby is the baby coming with the head? If the baby is coming with the head, fine, your chances are high. But if the baby is transverse or coming with the leg or the butt, your chances are low. Number 2, how well is the pregnancy progressing? I hope there is no preeclampsia. I hope there is no diabetes. I hope there is no placenta previa. If the pregnancy is progressing normally, you can go for vaginal birth after cesarean section. And number 3, how long ago did you do the surgery? See, I've seen women that have done 2 cesarean sections. They waited for like 5 to 6 years. And when they got pregnant, they delivered through the vagina. Because the more you wait, the better you heal. So you cannot have 2 surgeries in the last 3 years and you're expecting to go for vaginal delivery. You self-checker. Your last baby is not up to 2 years and you want to try vaginal delivery. It's risky. So the minimum time is 18 months or 2 years. If it's not up to that time, please don't even consider vaginal delivery after cesarean section for your own health. All right. And another thing to consider is the progress of the labor, because they might allow you to go to labor. Now, if labor is progressing normally, fine. If it's not progressing, they are preparing an emergency C-section for you. Then another one is the mother's health and the baby's health. If they are okay and optimal, then you can go for vaginal delivery after cesarean section. One thing I will tell mothers every day is that nobody is saying that you cannot experience whatever you want to experience. It's your body. You can decide to go for vaginal birth, whether the risk is there or not. But for once, sit back and think and relax and ask yourself, is it really worth it? Ask yourself if it is worth it. Because if you can, do you know that it will even save us a lot of strength if you can just deliver vaginally and go. But if your health is at risk, please, I am begging you, go for another cesarean section. You can at least have up to 4 babies with cesarean section. Most you have 6 or 7. Please. Some people will say they had 3 cesarean sections and they gave birth to the vagina. Let me not even talk. But please, please, remember that if anything happens to you, nobody's going to take care of your children. Nobody. So please, be very, very thorough. Be critical about your decision. Be very, very careful. So you not go and take a decision that you will regret later. All right? I'm Nelo, always at your service. Don't forget to follow, like, comment, and share. Whatever experience you have, drop it in the comment section. If you have questions, drop it in the comment section. Anything you want to share with us, we are here to listen to you. We are learning, all right? Drop it in the comment section. Follow and subscribe, and I'll see you in my next video, okay?